possible that you or someone you love is addicted to prescription drugs. Most of us take prescription drugs as a doctor tells us to, but for some people that's not the case. An estimated of 48 million people, according to the National Institute on Drug Abuse, have used prescription drugs for non-medical reasons. In this speech, I'm going to talk about addiction itself, how it increased in the U.S., and the most common abuse prescription, which is an opiate. Addiction causes compulsive drug seeking and use despite harmful consequences to the addicted person as well as the people around the person. A lot of people think addiction only affects the person who's addicted, but that's not the case. It can tear apart a family or a home if it gets really bad. What is really sad about most prescription drugs is that most people make the decision to take them voluntarily. After a person takes so many, they develop a tolerance to them, and it causes changes in their brain and starts to affect the person's self-control and ability to make their own decisions. Most people believe it's safer to take prescription drugs because the doctor gave it to them than to take street drugs, and that's not true at all. In the most years, there's been a dramatic increase in prescription drug abuse. This major of an increase has led to ER visits, tons of overdoses, as well as more and more people checking into drug treatment programs to get help for their addictions. In 2006, 2.6 million people abused prescription drugs. In 2010, that rate jumped from 2.6 to 7.0 million people taking prescription drugs for non-medical reasons. That is a huge increase in just 4 years. They say that after they develop intolerance to the prescription drugs, they're not getting high anymore. They're taking them to make them feel normal and to not feel sick and to help them function in everyday life. The addiction takes over all their choices, and the drug is their main concern every day. Opiates are the most common prescription drug abused in the medication, and it's a medication that relieves pain and are able to be swallowed. Remember this, that an opiate is to be swallowed. Unfortunately, to get the high that people want, they're snorting them, shooting them. They reduce the intensity of pain signals reaching the brain and affect those brain areas controlling emotions. Since the early 1990s, doctors have been prescribing opiate medications, but the opiate now is affecting the brain and central nervous system, which creates intense excitement for people who are doing it to get high. The intense excitement is what gets people addicted to the opiates. Common opiates include Vicodin, hydrocodone, Percocets, Oxycontin, oxycodone, fentanyl, and codeine. Opiates have short-term and long-term effects on people who abuse them. Short-term effects are the rush, the high that they get. It only lasts a short period of time. Drowsiness and slowing of cardiac function and slowing of breathing. Some long-term effects are, of course, infectious diseases, collapsed veins, and infection lining and heart valves. The addiction to prescription drugs can also cause some serious medical complications, including abscesses or boils on soft tissues on the outside or inside of your skin, liver or kidney disease, lung complications, clogging of blood vessels, arthritis, and hepatitis B and C. Not only does the addiction to the prescription drugs take a toll on your body, but it also takes a toll when you try to get off of them. Withdrawing from an opiate can be worse than getting started on an opiate. Your body can go into cardiac arrest, you can have a seizure, and it's impossible to quit alone. No matter what drugs anyone is addicted to, they're all bad for you. Your body, your health, and especially the people around you. There's tons of help out there now for prescription drugs due to how many people have abused them and how many people use them. Hope this information gave you some knowledge on addiction to prescription drugs, and thank you.